The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about liposuction, a new breakthrough, and one of the only people with this new technology in Arizona. In fact, he is the only one, and that is Dr. DeRouin. It's called tickle lipo and allows for better results. Dr. DeRouin, welcome to the program.
Well, thanks for having me, Randy.
All right. Now, how long have you been in Arizona, by the way?
I've been here since 2001. I came from the Midwest to join a cosmetic practice at that time.
Okay, now you're the founder, or the owner, I should say, the owner of Dermacare. You and your wife.
Yeah, I'm the co-owner, and my wife, who's also a board-certified MD, is my partner in the business. We have a cosmetic practice. It's known as Dermacare Cosmetic Surgery.
Okay.
And we're wholly dedicated to cosmetic surgery. We have a full-service skin laser and aesthetic practice.
Now she does the minimally invasive stuff, right? And you do the surgery?
That's right. I'm the surgeon. I do facelift surgery, rhinoplasty, brow lifts, eyelids, that sort of thing. I do the full-body liposuction, and Dr. Pamela DeRouin does the injectables such as Botox and Restylane, and she does resurfacing lasers, and we offer such things as aesthetic services, chemical peels, IPL treatments, hair removal, the typical spa-type services.
Okay.
So we're very proud of our practice. We think that people come to see us because they want a natural look following cosmetic surgery.
Now, I have specific questions about this new technology, tickle lipo, but your background, your training. Tell me a little bit about your background and training.
Alrighty. Well, I grew up in the Midwest. I'm from Michigan. I went to college in Michigan, medical school in Chicago. I interned in Detroit and completed my residency and surgical training in Maine. I taught at Ohio University for some time.
What did you teach?
Otolaryngology and facial plastic surgery.
Okay, good.
And then I did a fellowship period in New York City, and that's when I got into private practice.
I mean, you're one of the busiest facial plastic guys in the country. I mean, you've done well over 1,500 facelifts.
Yes, I have.
That's more than most guys do in a career. Is that fair to say?
That's absolutely true. I've been blessed in that regard, and we offer a minimally invasive facelift in our practice that gives patients a natural look.
You're the king of the low downtime facelift out there?
Well, I would like to be, but I don't know if I'm there yet.
Okay.
But we pride ourselves in our minimally invasive facelift.
Okay, liposuction. How long have you been doing that?
I've been doing liposuction since the mid-90s. And that's an area that has changed drastically.
How so?
And the refinements have been for the better. It all began with the development of the tumescent procedure, and since that time, we've expanded the technology. It used to be.
I mean, is it that much better now than it was back then?
It is way better than it used to be. In the old days, it was just a metal tube hooked to a suction apparatus, and we aspirated fat using force and elbow grease. It was unpredictable. It was traumatic to the tissue. People had irregular skin changes which were undesirable. And as time progressed, people were looking for a better way. And the better way was to apply an energy source to the cannula, the metal tube, in order to make the fat extraction more efficient. And since that time, multiple modalities have been tried.
Have you tried them?
I have tried. I've used the PAL system, which is the simple vibratory system, the Vaser, which is ultrasound.
Ultrasound, I mean, that's pretty good. The ultrasound, you like the ultrasound?
I do not like.
Interesting.
The ultrasound is very effective, but it does not have the safety profile of tickle lipo.
Okay.
It's a very powerful modality, and it's very effective in good hands, but there's a risk of skin damage, perforation, that sort of thing.
All right.
And then I use the lasers, and I actually own a smart lipo system.
So you have a smart lipo, a laser lipo.
I have it in my office, and it's a doorstop.
It's a doorstop. Does that mean you don't use it?
We think we've got the best technology going with tickle lipo. The safety profile.
It sounds gimmicky. When I hear, anticipating this interview, okay, and I hear tickle lipo, and already I'm thinking, is this a gimmick? I mean, so this is regular liposuction, but what's the difference? Help me understand.
Randy, it's not regular liposuction.
Oh, it's not. Okay.
And the name tickle is actually a nickname that was attributed to this system because it came over from Europe with a very funny name. It's called nutational infrasonic liposuction. And that nutation is just a physics term which describes the unique in and out circular vibration. And where that is applied, it permits the cannula to glide through skin with minimal trauma. It emulsifies some of the fat, loosens it up, so you're not aspirating these big chunks of fat, and it's more efficient because they're small.
When you say efficiently, what do you mean by that?
That's a code word for I can get more out quicker.
Okay, good.
And because the fat comes out in smaller parts, this allows me to have greater finesse. So it eliminates some of the lumps and bumps that were common with other techniques. And the safety factor permits me to do this procedure without endangering the skin. We can't burn it, we can't perforate it, we can't penetrate the abdomen with this. It's a wonderful, great advance, and we're frankly surprised that there aren't 50 of these in Phoenix.
But these machines are more than $80,000. You think that's why everybody's not doing it?
I think the price point is actually a deterrent. Also, many people have their own equipment and just don't want to make the change, and they don't want to go through the learning.
Many people meaning other doctors, other plastic surgeons, whatever.
Other doctors don't want to make a change.
But it doesn't cost more than regular liposuction.
Oh, the patient doesn't have any more charges, absolutely not. But many people don't want to acquire expensive new pieces of equipment in this economy. We're blessed. We were able to try out all these other systems. I've got experience with each of the systems we mentioned, and this is where I wanted to put my dollar.
Is that right? Now, is it true they're not doing it while they're under anesthesia with the tube in their mouth or whatever?
Exactly.
Is that right?
We can now do this under local anesthesia. The patient walks in, the patient walks out.
Really?
They resume their life in a few days.
So it is low downtime as well?
Absolutely.
So like for abdomen, a woman, a man, they go in on a Friday. Could they go back to work Sunday?
I did my wife on Friday. She went to the gym on Sunday and went and worked on the emergency room on Monday.
Interesting.
So, if I didn't believe in the system, I'd be the last guy doing my own spouse.
Is that right? And by the way, we should mention your wife. As a plastic surgeon's, wife, flawless skin, absolutely natural results. But that's her thing. I mean, she does skin at the laser stuff. At
absolutely, absolutely.
She's definitely a living example of what could be done. So
well, thank you very much. But we have this kind of confidence in this technology. There's simply nothing like it. And one thing that should be mentioned also is that the many systems that are emerging now, they give you a treatment and then something happens and then you wait for time and come back. We like this, what you see is what you get, not a guesswork of you treat it, you freeze it, you inject it, something happens, who knows what, and then you come back.
Okay, so we're talking about liposuction. So many of the new technology is you get one treatment, you wait a few months, and then it takes effect. This is instant gratification.
Yes.
Is that right?
And
I don't want to put words in your mouth.
No, it's not instant gratification, but it's instant assessment. This permits me to know where I'm going. Who would ever turn their car down a darkened road without their lights on? I mean, I can see where I'm going and what I'm doing. And this permits me to do a better job for my patients.
Okay, now what are the common areas? Tell me all the different areas of the body that you're doing liposuction on.
Well, we actually, treat pretty much the whole body. We, the neck, the male chest is a common area, the abs, the waist, the flanks. We do the inner and outer thighs. We do the knees.
The back? What about the bra strap area?
The bra strap area. We refer to those as upper flanks in our practice. In some instances, we do lower extremities, the legs. But by far the most common procedure is the combination, what we call the midsection, which is the abdomen, the waist, and the hips, which are love handle areas, and also the bra strap area.
So you're actually still removing the fat. It's just this tickle lipo, this energy source, breaks it up. Would you say it dissolves a little bit, or just breaks it up to make it easier to to pull out of the body?
The tickle lipo machine actually emulsifies or mobilizes some of the fat cells that permits an easier extraction. And this is the big benefit. We're not taking out big hunks and gouges of fat. We're taking out particles of fat. And we can apply this directly beneath the skin and make it smooth. This is our big advantage. Whereas you bring to bear a laser or something with great cutting power, then you risk damaging skin.
Are the patients, are they getting older and older or younger and younger over the years that are coming in for liposuction?
No, the patients are really broadening. We're seeing, we've done patients in their late 70s and in teenagers, and it is quite rewarding.
I mean, they're fitter patients just with little areas?
No? That can occur, but Oprah tells us that 70% of the women in America are obese. I don't know if that's true, but that's a lot. And some of these people will work hard with diet and fitness regimes to lose those troublesome fatty areas, their love handles. We've seen people that weigh 115 pounds and have love handles that drive them nuts.
Okay.
And this is something that we can take care of in a couple hours.
Is that your favorite kind of a patient, though? The leaner patient that has these tough areas?
Well, the leaner patients are very, very attractive to us because they're highly motivated. They want to be better, and they're going to stick to it. And the patient who has a lot of going for her in the way of fitness and attractive, they get great results.
Now, are there people that run 10, 20 miles a week and they just have this one area, like a saddlebag area, that they can't get rid of?
Well,
Is that who you want, the fit person that just has these?
Well, yeah, obviously we love those patients. We don't. We're not trying to dissuade others to come, but I brought along a patient who's just that. This patient's been a vegetarian for 10 years, runs 12 miles a week, and just can't get these areas to respond. And so we did liposuction in her abs. We took care of her inner thighs and her love handles, and now she's got a six-pack and looks fantastic, and her inner thighs don't rub, which is a big deal for many women. They object to their inner thighs touching, and they don't now.
All right. Now with liposuction, I mean, are you going all the way around?
Absolutely.
Okay.
So we have a package that we recommend for many patients. We actually refer to it as the midsection package, and we'll do the full abdomen, the waist and hip area, and the upper brow roll, and that restores the patient's natural contour. And many people are very unhappy with the way they look in clothes or the way they look without any clothes, and this greatly restores their self-esteem.
What about men? So more and more men are coming in for this?
More and more men are coming.
Real men?
Real men.
Okay.
We actually have servicemen who are required to make certain measurements, and they'll come in. They're very fit. They're running on these fitness regimens, and they just can't get rid of the trouble spots. And the military has one requirement for pretty much all sizes, which we don't quite understand. But in any event, we've been able to help servicemen with this problem. Other men, they work out, they do a great job with their diet, with their lifestyle, and then they've got these love handles, or they've got this little pooch around their belly. They're very fit. They're very dedicated to a healthy lifestyle. They just can't get rid of it.
But for men, I mean, they could lose the most pant sizes, right? Like a couple pant sizes?
Absolutely. Absolutely. And frankly, the change in attitude in recent years is different from the old days.
What do you mean by that? What do you mean?
Well, I was pointed out to me one time that a woman would never buy a pair of jeans with the size on the outside of the jeans.
Okay.
Where we all buy Levi's and have our waist size like we don't care. Well, guys care now. And we're seeing more and more people who want to look the best they can. And this provides them the avenue to get that change.
Okay, for people just tuning in, we're talking about the new tickle lipo system that I guess this energy source in the cannula itself, is that correct?
That's correct.
That allows you to remove more fat.
Yes, sir.
Is it FDA approved for this?
Absolutely. It came from Europe. The system was referred to as nutational infrasonic liposuction in Europe. It had been in use there for approximately 15 years. Very, very popular. And it came over about 4 years ago.
Were you skeptical when you first heard about it?
I was.
What sold you, by the way?
I was able to demo the equipment and actually see with my own eyes the effectiveness of the fat extraction, and then the safety feature, the safety aspect made it compelling. Now I've got a system where you virtually cannot injure somebody.
And they do it while they're awake, so there's lower downtime. What about less discomfort? I mean, did people complain less about soreness than they did in the old days?
Oh, very much so. And there are less complaints during the procedure as well if you try other systems and they're local. But we have less bruising than with other systems, more efficient fat removal. And this has been actually one of the most exciting things to happen in my lifetime.
Really? Okay, good. Now you brought a lot of photos.
Yeah.
So we'll start wherever you want to go.
Okay. So the patient I was talking to you before, this is the patient who is very fit. This patient runs 4 days a week. She's a vegetarian. She's a beautiful woman and has these trouble spots that just aren't responding to this dedicated lifestyle. Look at the inner thighs on this before picture.
All right.
They're actually rubbing together. This drives her nuts.
So they tell you that? I mean,
absolutely. This lady runs 12 miles a week. Right. It bugs her. Also, she's got a little fat around her lower abdomen.
Her abs look pretty good.
They look great, but not to her.
Okay, okay.
She's very self-conscious, and she wants a six-pack.
Okay.
If you look at her view from behind, she's got some muffin tops hanging over her underpants.
I see.
And she doesn't want that. And this is Gail, as I mentioned, has a dedicated lifestyle. She runs and exercises. She has a very healthy eating, and she can't get rid of those muffin tops in love handle areas. And she wants relief from this. There's nothing more she can do short of starvation.
Okay.
So that's where she came to see us, and as we'll show you,
let's take a look. Let's take a look at the after.
Okay. Post-operatively, let's look at her inner thighs. Pretty much similar.
Not rubbing anymore.
There's air and plenty of space between them, and from the back, now we've restored that lovely hourglass figure that she wanted.
Now in the rear view, especially above the panty line, you could see that those love handles are gone. I mean, that's perfectly flat.
Absolutely. And they're gone forever. This is a permanent change. This is not temporary. Some cosmetic procedures need to be repeated. This isn't one of them.
Now this is just a couple weeks post-op. I mean, so it gets better. It gets better. I mean, there's some redness. I mean, it'll smooth out even more.
Absolutely, absolutely. And any degree of healing that's incomplete will take care of itself later. If we take a look at this young lady, her concern is how she looks in clothes. She has a belly that protrudes. She's got love handles and muffin tops, and she's young and fit. She's attractive. She's just unable to control these problems with lifestyle changes.
Okay.
Then she comes to see us, and very substantial improvements are made.
Do they ask for tickle lipo, by the way? I mean, do you do some local advertising about tickle lipo, things like that?
Many people find us on the internet and they're attracted to the tickle lipo because of the safety profile.
And you're the only guy doing tickle lipo.
And we're the only one.
You got a monopoly on tickle lipo in your area.
We would love to have it. We would love.
I mean, you do if you're the only guy with the machine, right?
Yeah.
Okay, so the after, very nice. So perfectly flat.
Perfectly flat, nice contour behind, and the muffin tops they're gone.
What's wrong with diet and exercise?
Nothing's wrong with diet and exercise, but diet and exercise cannot affect these specific areas where you're genetically predisposed for fat accumulation. As I told you, I have one patient that weighed 115 pounds and still had love handles. And with our surgery, we were able to eradicate that. You would say that she was thin unless you specifically would look at those areas. And her little muffin top, love handle areas, they were made for us, and we were able to help her.
Now we've talked on the phone. You said that after like a liposuction procedure, that now they start eating better, exercising more. It like gives them leverage to take action. I'm paraphrasing a little bit, but
yes, I mean,
tell me about that.
Well,
what you see in your practice.
We'll see patients who really like to look better, and they come to us for help in these areas, but then they become revitalized. Now they realize that, I really can look better. And some of the most happy patients we've ever had have used liposuction as the stepping off point towards a healthier lifestyle. And we've got numerous patients who lost weight, embraced exercise and fitness regimens following liposuction. It's pretty incredible.
So it's safer though, and it's safer now. Why? Because
this tickle lipo is safer for a couple of reasons. Number one, we've removed the need for general anesthesia, so that whole
that's big.
That whole family of anesthesia risk are completely eliminated. We do it under local anesthesia. Secondly, we have a machine, as I mentioned, that has automatic cutoff when we engage resistance from the skin or from deeper structures. That permits us to work without the risk of perforating the skin or perforating the abdomen.
Okay.
So,
what are the fears, by the way? I mean, if it's such a popular procedure, because everybody I know, not everybody I know, most people I know, telling me you were going to come on the show, they all want lipo. But they all have their reasons for not doing it. What are the hesitations you hear? What are their fears?
Well, most people's fear is just uncertainty. They're not sure of what they're going to get, and they're afraid of pain. And some people it's cost. But this new tickle lipo it's safe, it's relatively pain-free, and it's very affordable.
Okay. Other areas, other pictures. What else?
Well, here's a patient which is a little more typical. She's in her 40s. She's had a couple of children. She was a lovely, and still is a very lovely woman, but she wants to be beautiful. She wants to be great.
Okay.
And she's very self-conscious.
And that's in her 20s, you're saying?
No, that's in her 40s.
In her 40s, okay.
And so she wants her old body back, or wants to come as close to it as she can. And her problem areas are her abdomen, waist, and hips. And as you can see, we had a dramatic improvement.
Very nice.
And she's gone from being an attractive lady now to a little hottie.
Yeah, that's a perfectly flat stomach. So in clothing, obviously, a flat abdomen on a woman is very attractive.
Very attractive.
They look fit and young. It's a young look.
And this is very rewarding for us to be able to help somebody in this regard.
And we should disclose, because sometimes when we do these cosmetic shows, we get emails of people saying, well, what's wrong with healthy this? But we should point out, I mean, this is not for everybody, but if you're bothered by it, that means if you're going to do lipo, and millions of people every year do lipo, if you're going to do lipo, you might as well go for the best, most predictable lipo available, or at least a doctor that's got a lot of experience in lipo. I mean, that's the point. If you're going to do it, in your opinion, you have a bias, but tickle lipo.
Absolutely.
I'm not endorsing this. I'm just saying.
No,
is that how you're feeling?
If you want or feel the need for liposuction, find a surgeon who's very active in his practice.
Do you do these every day?
We do these every day.
Is that right?
We're doing a half a dozen of these a week. Find a surgeon who's dedicated to cosmetic surgery. He's not doing this as a sidelight or
like dabbling in it.
Find someone who's got a lot of experience. The reason that makes tickle lipo so compelling in comparison to other techniques is the safety profile. This is not only the best because it's the most effective, it's the best because it's the safest.
So when we say best, and we have to be careful on this show, because people need to know this is a real interview, it's your truth as you see it, I'm not endorsing you, but when you say the best, we don't have to put disclaimers, the best in your opinion, from a guy that's looked at the other technology.
From someone who's used conventional lipo, ultrasound-powered, laser-powered, in my opinion, this is the best and safest liposuction technology available.
Best defined by the best results.
Yes. It's the most effective and safest liposuction technology
and like
available.
what you said a little earlier, I said, we'll define this or define that. You say, well, it allows me to pull more fat out easier.
That's correct.
Is that right?
That's correct.
So this vibration, this tickle that creates a tickle in certain people, like breaks up the fat, emulsifies the fat, and then it just nicely sucks right out.
That's right.
And that fat doesn't come back.
No.
Those fat cells are dead or gone.
Those fat cells are, our joke is they're in the bucket. And
is that your joke?
That's our joke.
It's an inside
the
joke.
canister that where the fat is taken, and the patient can see this during the procedure. Those fat cells are gone, and like 99.9% of them are gone forever.
Okay, let's do some quick photos because we are out of time completely. We'll go through some photos here.
Okay, have a look at this patient. She's a beautiful young woman. She is very unhappy with her thighs, both the inner thighs and the saddlebag area, the outer thighs. As you can see, her thighs touch with her feet apart.
So her knees are far apart, okay.
And after surgery, where we did the inner thigh, the knees, and the saddlebag area, she can now put her feet together, and there's air
so when
between
you
her
look at
thighs.
side by side, okay, so her knees are now closer together, and there's space there.
Yes, sir.
I guess that makes a big difference in pants. And
now this patient can run and walk, and she doesn't have her inner thighs rubbing together and getting chafe. You got to look at the rear, Randy. You can see a tremendous...
That's the same woman?
It's the same woman. This woman is so thrilled with her results. She feels great about herself, and look at those thighs. Her pant size has changed. She looks good both with and without clothes, and she is very, very excited, and we couldn't be happier.
Okay, good. Okay, well, we're out of time. There's people that are watching this. Maybe they've heard about tickle lipo. They could go to your website, learn more about tickle lipo. You're one of the only guys right now, board-certified surgeons, that have tickle lipo in your area.
Phoenix. Mm-hmm.
In Phoenix. And it's safe. You're saying it's effective. And so they don't like the fat that they have that they can't get rid of. What's their first move?
Give us a call.
Well, thank you for coming to the show. Great stuff. Good before and afters.
Thank you very much, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Put in Dr. DeRouin, which is probably tough to spell. So you could just put in liposuction or tickle lipo, Arizona. That'll pop right up on my website. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.